Welcome to the Health Zone, our weekly health chat show. I am Dr. Toju Chikiobi. Everybody calls me Dr. Toju. This week we will be talking about heart attack. With us in the studio is going to be the terrific Dr. Yemi Johnson, and he will help us to understand so much more about a heart attack. He'll tell us what causes it, what we can do to prevent it, what the signs and symptoms are, and what we can do to help somebody who has a heart attack. So do join us in the show. Come on. With me in the studio today is Dr. Yemi Johnson. Dr. Johnson is an interventional cardiologist with over 30 years experience in the field of cardiology. He has many research papers, up to 80 research studies that he's been a part of. He's very active on the international scene, giving lectures and talks. And he's also very active in Nigeria, helping different parts of the country set up hospitals and set up cardiology departments. We're really thrilled to have him with us here in the studio today. Welcome to the Health Zone, Dr. Yemi Johnson. It's a thrill to have you.
Well, thank you.
So Dr. Johnson, as we usually do on the Health Zone, we will go out to the man on the street and find out what they know about heart attack. Is that okay?
Oh yes, good. That would be interesting.
Okay.
Welcome to the Man on the Street segment of Health Zone. Today we'll be asking people what they know about heart attacks. So please don't go anywhere. Stay with us.
Yeah, heart attacks, if somebody is taking too much.
It's a sudden incident that can come to you. You can fall at any time.
Heart attack is like when the heart, it's about when the heart is let me see, it's stiff, and it's kind of busy, or it's kind of, that's meaning of heart attack, as in when the heart cannot take anything.
It's a heart disease, it's something about heart disease that might cause stroke and cause death.
We're thinking, and stress, let me say stress, yeah.
Heart attack can be caused maybe by shock.
You'll probably be kind of in a coma or something, and
it happens to someone impromptu, something you don't know. It just catches you, and before you know it, life has gone.
I understand it starts from some sort of strain from the head.
I think when you have chest pain, and I think when you have a swollen leg.
Thank you for staying with us on Man on the Street, the segment that comes to you from Health Zone. We're heading back to the studio with Dr. Toju now, and she'll give us all the information we need to know about heart attacks.
Wow, Dr. Johnson, that was really interesting. People had a lot of interesting ideas about heart attack. So hopefully on this show, you will help us clear up a lot of the things that we heard out there, and we'll address those as we go on. But so tell us, what is a heart attack?
Okay. In simple terms, a heart attack means there is damage to the heart muscle. So what does that mean? The heart is supplied by blood vessels that supply oxygen to the muscle. Now your heart contracts like this. So if some part of your heart does not receive oxygen, it gets damaged. That's what a heart attack is. It's like those of you who have cars. If your engine knocks, that's what a heart attack is in a human being. The engine has knocked. It doesn't mean the car is dead. It just means it's damaged and you have to repair it. That's what a heart attack is.
What exactly, when you say the heart is damaged, what exactly is happening to the heart? Is it only if a little bit of it is damaged, or is it if all of the heart damaged when you say there's damage to the heart?
Okay, let's put it this way. My hands are the heart.
Yes.
All right, so it's contracting like this. Now, if this whole part of it gets damaged, that's a big heart attack. If just my thumb gets damaged, that's a small heart attack. So the extent of damage depends on where the blockage of oxygen occurs. So if it's at the beginning of the blood vessels, it will damage a large amount. If it's at the distal end, it will damage a small amount. So it all depends on where the problem is. That depends on, gives you the extent of damage.
Okay. So what causes these blood vessels to be blocked?
Okay. The basic thing is blood vessel is a tube, like your water pipe. It gets clogged up inside. And once that narrowing gets totally closed off, that part of the heart doesn't receive any blood. That's what causes the heart attack. Now, what causes that narrowing is cholesterol. In almost everybody, it's cholesterol buildup that causes the narrowing. Then at the end, it's a blood clot that closes off the vessel and then causes the damage. So it's narrowing by cholesterol and then blood clots at the end.
So this isn't something that actually happens suddenly, because we always think of a heart attack as it's a sudden event.
In most cases, yes. The blood vessel is getting narrower and narrower, just like a water pipe.
Okay.
The pipe gets narrow, the water pressure gets lower and lower, then suddenly it stops. That's a heart attack. But in some people, it can happen out of the blues. No narrowing before, a blood clot just comes and closes off the vessel. Okay. So most times it's slowly, and then suddenly you get a heart attack. But in some people, maybe 10%, it just happens out of the blues.
I see. Is heart attack a disease that's new to Nigerians, to Africans?
It has always been around, but like when I was in school, it was very uncommon to see a heart attack, very uncommon. Now it is a lot more frequent, and the reason is we have changed our lifestyles. We are now developing bad habits, smoking, eating fast foods, not exercising, things like that.
Okay, wow. Some people say that, oh, heart attack is a disease of the white people, of Caucasians, is not something that we see often in Africa. So you explain that it is true, we didn't used to see it, but we're seeing it more because our lifestyle is becoming more westernized.
Exactly.
You know, we're eating the wrong sort of things, and I guess we're not as active as we used to be. We're riding in cars, we're not walking everywhere like we used to do. We're not working on farms, we're not doing all of those active things.
Well, what you say would make it sound like it's only rich people who have cars that get heart attacks. No. Exercise is one part of it. But if you notice, people don't walk anywhere anymore. Even the average man, they take Okada. Okay. So the exercise is almost gone.
Yes.
Now, that in addition to fast foods, and it's not just KFC and American fast foods, our own Nigerian fast foods, the Buka foods, you go to the Buka, you see the rice, and then you see the stew with a lot of oil, palm oil and things like that. That's what causes our trouble.
Okay, interesting. What sort of symptoms do you have that? How do you know you're having a heart attack? What kind of symptoms?
Well, that's very important. Most people get chest pain.
Okay.
All right. Now, the chest pain can be any part of your chest, but chest pain that feels like somebody's squeezing your chest or somebody's sitting on your chest, and then you feel the pain going down your arms or up your neck. You start to sweat. You get short of breath. You feel very sick. 9 times out of 10, that's a heart attack. You should have it checked out. Okay. Now, some people don't have those symptoms, especially diabetics. A diabetic might not have chest pain.
Okay.
Diabetic might just get short of breath or start to sweat and think maybe their sugar is low. But if they don't check it out, they'll have damage to their heart and they won't find out till the damage is permanent.
Okay. What sort of complications can there be from a heart attack?
Well, the worst complication is death. You can die. All right, about 20% of people whose heart attack is not treated will die. If you get treatment early, that percentage goes down to less than 5%. So it is important to get to a hospital that can treat a heart attack early. So that's the worst complication, death. Next complication is heart failure. Now, heart failure means your heart is not functioning as well as it should. So it would be like a car. If you have a 6-cylinder car, it is now working with 2 cylinders. It will get to where it wants you to go, but it will go there very slowly. So that's what heart failure is. It makes the heart muscle weak. It makes your body weak. You're unable to climb up the stairs. You can't breathe properly. That's what heart failure is.
Okay.
Those are the main complications. Yeah.
So Dr. Johnson, sometimes I've heard this, you know, as you age, you develop pain in your legs, and most people attribute it to arthritis. But I understand that in some instances, it can actually be an early warning sign of an impending heart attack. Is that so?
Sort of. Now, pain in the legs is common in elderly people. Oftentimes, it is arthritis. But sometimes it's something called claudication, which is peripheral vascular disease in medical terminology. What that means is there is not enough blood getting to your leg muscles. So when you walk, your muscles require more blood, but the blood is not getting there, then it causes pain. The difference is not easy to describe it to a non-medical person, but arthritis occurs in the joints, in the knee joint, the hip joint, in the ankle. Claudication, that from the pain from poor circulation, occurs in the muscles, like in the calf muscles or in the hip and thigh. But you need to have your doctor check it out and check the blood pressure in the legs, check it in the arms, and see if there's a difference. But yes, if you have poor circulation to the legs, it puts you at risk for heart disease.
All right, Dr. Johnson, we're going to take a short break and we'll be right back. Okay?
All right.
When we come back from the break, we will talk about who's at risk for heart attack, because there are people who feel that because they're young or because they're women, they're not at risk. So Dr. Johnson will help clarify that for us. Welcome back to the show. Today we are talking about heart attack with Dr. Yemi Johnson. Dr. Johnson, can you tell us who's at risk for heart attacks?
Okay, now what puts you at risk for heart attack, there's several things. First of all, if you have hypertension, which is very common in Nigeria, high blood pressure. Next one, diabetes. All right, diabetes is also quite common. High cholesterol puts you at risk. Smoking puts you at very high risk. Inactivity, obesity, being too fat, those things all put you at risk. Another major component is stress. This is difficult to measure, but stress does increase your risk for heart disease and heart attack.
Okay, so people who say because they're young, they don't have to worry?
Well, people who are young, yes, it is true. When you're young, you're not usually at risk for heart attack when you're in your 20s or 30s. But if you don't look after yourself and prevent the risk factors from occurring in you, you will put yourself at high risk when you get into your 40s and 50s. So people who get heart attacks when they're 40 and 50 is usually because they had risk factors when they were young and they were not taken care of.
Okay. You mentioned obesity as one of the risks.
Yes.
What is obesity?
Obesity means you're too fat. Now, what do we describe as being too fat? Now, am I allowed to stand up? See?
Yes.
Okay. If you are bigger than me and my height, you're too fat. You're obese. Because I'm just a bit above my normal weight. But anything bigger than this means you're too big. Now, what does that do? One, it puts you at higher risk for diabetes, because the incidence of diabetes is increasing worldwide. And the number one reason is obesity. People are too fat, not exercising anymore. When you're obese, it makes your cholesterol go up. All right, then there's something called metabolic syndrome that obesity predisposes you to. So being obese is not good.
Okay. I'm really glad you're addressing the obesity issue, because I think it's something we all need to be paying careful attention to.
Yes.
So if I find somebody having what looks like a heart attack based on your description of the symptoms, what can I do to help that person so that that person doesn't have a bad outcome?
Well, first thing is if you have aspirin, let the person take some aspirin. Usually we say 300 milligrams. That's 4 baby aspirins. Give them aspirin and then get them to the hospital as fast as you can. Whichever means you can to get to take them to the hospital is the best thing you can do. Okay. There are all the other myths that people talk about. They don't do anything. Aspirin, get the person to the hospital.
So I shouldn't be trying to, you know, slap the person, pour cold water on their head, or doing anything like that?
No, unless the person has gone into a cardiac arrest. The cardiac arrest means the person is dead. They stop breathing. Heart has stopped beating. Then you need to do CPR if you know how to do CPR.
Yes.
If you don't know how to do CPR, get somebody who can do CPR real quick. And if you have a vague idea, the important thing with CPR is just keep pumping on the chest while you get help. You don't have to give mouth to mouth. Just pump on the chest and try and get help. So that's the difference between a heart attack and cardiac arrest. Cardiac arrest, your heart stops. Heart attack, your heart is damaged. It doesn't necessarily stop, but it can lead to a cardiac arrest.
All right, thank you very much, Dr. Johnson. We'll take a short break now and we'll be right back.
All right, thank you.
Welcome back to the show. Today we are talking about heart attack with Dr. Yemi Johnson. Dr. Johnson, what is the reality of treating heart attack here in Nigeria and in sub-Saharan Africa?
Well, reality is not very good. Majority of the people who get heart attacks are in places where there's not good health care available. So to get properly treated for a heart attack, you need to go to a hospital that can do an ECG, that has people who can interpret the ECG, and then give you the appropriate treatment. Unfortunately, our healthcare is just beginning to develop, and those facilities are not available around the country. In Lagos, there are several places you can go to. In Abuja, there are several places you can go to. I do not know about the rest of the country, but you need to go to a hospital. Wherever you are, go to a hospital and then let them sort it out and tell you where else they can send you to.
So it seems to me that given that we're in a setting where proper healthcare is not available to a vast majority of the Nigerian and African population, it seems to make sense that we should really focus a lot on prevention.
Yes.
On not getting to the point where we're having a heart attack in the first place.
Exactly.
So what sort of things do we need to do to prevent a heart attack?
Okay, there's several things. As an individual, you need to have your blood pressure checked. Make sure it is not high. If it is high, take your medications and control it. The biggest problem I have as a doctor is convincing my patients to take their medications. They feel, I don't feel bad. Why do I need to take these drugs? Can't I take them for a week and then stop? Blood pressure medications are for life. It's difficult to convince people, but commonest cause of strokes and heart attacks amongst people who see their doctors is not taking their drugs. That's the commonest reason. All right, next thing is to eat healthy. We need to reduce the amount of meat we eat, reduce the amount of fried foods, eat more healthy foods, eat more vegetables, eat more fish, eat more chicken. That helps. All right, you can bring your cholesterol down by 50 points with just a good diet. Exercise always helps. We need to improve our lifestyles and exercise more. Now, one thing I don't think is a big problem in Nigeria, but it is a problem with some groups of people, is smoking. There is absolutely no good reason to smoke. It is suicidal. But some people smoke. Smoking is the most preventable, reversible cause of heart attacks. I mean, you don't need to smoke. I used to smoke. I know what it did, and I've managed to stop smoking. So I think everybody else can stop smoking. All right, those are the main things. And then if you have diabetes, control your diabetes and have your doctor follow you regularly. So bottom line is, visit your doctor regularly, have them keep you in check, make sure your indices are fine, and that's how you prevent a heart attack.
You know, there were some things we heard on the Man on the Street interviews where a lot of people mentioned that thinking, doing too much thinking caused a heart attack. And you mentioned stress as a big part of heart attack risk factor that you can't really quantify. So can you talk to us a little bit about that? How do we manage stress?
That's a very difficult question to answer. We know stress puts you at risk. Now, how do you get rid of stress? Some people have a stressful job. All right, so you tell the person, look, your job is too stressful. You need to cut down. So they quit. Then they get broke. They have no money. Then they're in another sort of stress. So it's difficult. Now, I have many patients who go abroad for holidays and things. When they go abroad, their blood pressure comes down. Their doctors take them off their medications, and their blood pressure is fine in England. As soon as they get to the airport, pressure goes back up, and the stress starts again because you don't have electricity, your generator is broken down, diesel price has gone up, all sorts of things. So Nigeria is stressful. There's nothing we can do about that until things improve, which they will. But you've just got to accept the fact that it is stressful. Don't try and solve every problem on earth, because you've got to remember about your own self. Now, as far as thinking goes, thinking on its own is a good thing. It's good to think. But if you're thinking depressive thoughts, that probably is not good. But exercise helps you relieve some stress. So it's always good to try and get some exercise and relieve the stress. Don't go and drink 2 bottles of wine or gogoro because you're under stress. That won't help you. But exercise, healthy lifestyle will help.
Thank you very much for clarifying that. Dr. Johnson, it's been great having you here on the Health Zone with us. You have improved our knowledge of heart disease and heart attack tremendously, and I'm sure that our viewing audience is much more knowledgeable about it now than when you first came. So thank you very, very much for being on the show, and I hope you'll come back again and help us with some other topics.
Oh, certainly. It was fun. Thank you.
And so we will take a short break now, and we'll be right back. So what is the take-home message about heart attack? The number one thing is that heart attack is commonly fatal in Africa because of our poor health systems. So your best option is prevention, to make every effort to prevent heart disease so you don't develop a heart attack. The most important things you can do to prevent a heart attack are to make sure that you're not obese, you're not overweight, to make sure that you're eating healthy, make sure that you're staying physically active, keep your cholesterol level down. If you're hypertensive, treat your hypertension and stay on your medications. If you're diabetic, treat your diabetes and stay on your medications. The most important things you can do for yourself to prevent a heart attack are to make aggressive lifestyle changes. Eat well, exercise regularly, make sure you're not overweight. The sort of things you're eating are vegetables and fish and fruit. Limit your alcohol intake. Drink a lot of water. Stop smoking if you smoke already. And do the very best that you can to manage your stress. We're in Africa, stress is all around us, so making these aggressive lifestyle changes is really what's going to make a difference and prevent you having a heart attack. As always, it's been great having you on the Health Zone. This is Dr. Toju saying, stay healthy.